Welcome. My name is Jennifer Roeder, and I'm a communications consultant for APFED. I'll be moderating today's webinar about college considerations for chronic disease. We have two featured guests today joining us to share some tips. Dr. Tim Miller is the Vice President of Student Affairs at James Madison University. Bridget Betts is the Director and Global Liaison for the Moses Center for Accessibility and Inclusive Culture within the Office of Global Inclusion at New York University. Welcome, Tim and Bridget.
Thank you very much. Excited to be here with you.
Thank you. Welcome, everybody.
So I'll just jump right in. So I have the first slide here. What I wanted to do is just do a broad overview of some things to think about as you're doing this process. So these 5 areas: the college search process, transitioning, navigating accommodations, which I'm going to touch on very briefly because Bridget's going to do a great job on that area, and then communication on campus, and then community on campus. So first, the college search process. As you're looking and trying to figure out where your young person's going to go, think about all the different factors around a college campus. What's the population size? What's the setting? Is it a rural place? Is it urban? What's the terrain? Is it flat place, steep? Just knowing those things are going to be important. And what's the weather like? So having those big, I'll call them sort of climate considerations, are going to be important as you look at the schools on your list. Then also, which of these factors might pose a barrier that could reduce bandwidth, reduce access, reduce the experience for the student. And then also think through what are the opportunities and the services there, but also what's the community going to feel like. And last, and I say this to everyone in every job search, be careful about falling in love with the idea of a place or the allure of a name, or a family member went there, or even a parent or caregiver had gone to that school. Just because it was a good fit for that person might not mean that it's a good fit for the student going through. And I always want to remind everybody to pay attention to your gut. Something's going to feel good or not good in a space. May not be love at first sight, but pay attention to your gut as you're looking and making those college search choices and narrowing them down. Academics important, community is important, but you have this other factor that you want to be taking into account here. And then in the transition, now, okay, you've maybe narrowed down on 1 or 2 places. Start building some of those skills. What are those skills early on to move from parent-managed care to self-managed care? Students learning to set up doctor's appointments, refilling medications, developing independent responsibility for their care routines. How are they going to get groceries, making meals, and things like that? All these are things you can practice before college, but start thinking through some of that. What is the mental health counseling opportunities in that new college town like? And to have that support during, and then during that process, before, during, and after the transition process. Then early planning and communication is going to be important. What's your plan for if there is a flare-up, hospitalization, things like that? You want to have that in place. That might feel sort of anxiety-inducing, but it really will manage sort of a lot of that stress and anxiety if you remove some of the ambiguity on the front end. Who's in an emergency contact? What if your student is 3, 4, 5, 6 hours away? Is there a family member, a close friend who's near where the school is that they're going to, that can maybe step in if they can get there more quickly than you? Working with the campus resources, the University Health Center, local provider, setting up those doctors on the front end. You want to have those established for you before the student gets there. Getting ahead with the counseling center, with the Office of Disability Services, doing all the paperwork well ahead of time is going to be important. Managing medications and insurance coverage, having a plan for that. And then transitioning from pediatric to adult providers early. So doing that before they head to college so that you already have that in place so there's not some confusion there. Navigating accommodations, I'll just mention 2 things. They're intended to remove barriers to access. That's the point of those accommodations. And remember that documentation requirements may vary from school to school. And like I said, Bridget will go into that much more than me, so I don't want to steal her thunder in what she's going to cover. And then when you think about communication on campus, having emergency plans for different scenarios. Think through all those different scenarios might occur, and who you're going to work with. Each professor, you need to work with them individually. There's usually residence life staff. There'll always be that, but also a dean of students that might help and coordinate some of that for you. But realizing that individual interactions with professors are going to be important. And then again, thinking of the student as the decision maker and the driver, and the parent is in support of the student. The student will be primary contact through privacy. You won't be able to know every single thing that the student is managing unless they share that with you. Normalize early on that the student's health needs to be prioritized. And sometimes you may have to take a short or long break from school. There may need to be a semester break, maybe even a year break. So just know and go into that accepting that that might be part of it, and then work through that if that might occur, and realizing that stress can contribute to the chronic illness and exacerbation of those different aspects of it. And oftentimes we've seen this, students will push through those challenges to a negative point that their health is really impacted, and then grades and everything else can be impacted. So having that open communication with your student and knowing that they can come to you when there are concerns and how things are going, so they don't think, oh my gosh, I just have to push through the semester. There are withdrawal options, there are incompletes, there are other things you can do in those moments if you're mid-semester when some of those challenges come up. And then lastly, community on campus. Do some research on the front end. What student organizations exist on the campus? What community exists both on and off campus? Are there community organizations, ways they can connect and build that sort of network for themselves? For us, examples are the College Diabetes Network for our students. And also we have a group called DREAM, which stands for Disability Rights, Education, Activism, and Mentoring Group. So are there groups that your student can connect to that can be people and community for them to be a part of that can help them? So that's a few quick things to think about as you're making this transition journey, and I will pass it off to Bridget.
Good afternoon, everyone. Hi, my name is Bridget Betts, and I am the director of Moses Center for Student Accessibility and Global Inclusion at NYU. I also serve as the global liaison for all of our global sites, as well as our standalone sites, NYU Abu Dhabi and NYU Shanghai. So it's very nice to meet you all today. So I'm going to give an overview about academic accommodations in a college setting. So again, what we say, what is a disability? So universities are responsible to ensure an accessible university experience for all students with disabilities by removing or minimizing barriers to educational access. So really, that is what our role is in higher education. So next slide. Okay, so what is an academic accommodation? We'll start with academic accommodations and then we'll go into housing accommodations. So an academic accommodation is a reasonable adjustment or modification to practice or policy that allows a student with a disability equal access to all the university academic programs. An academic accommodation is not a fundamental alteration of the program requirements and standards. So I just wanted to discern both of those, just give you what an academic accommodation is. Okay, next. So these are just some examples of academic accommodations in higher settings. So extra time for exams, smaller proctor testing environment, reasonable breaks in class, reasonable break, stop the clock during exams, consideration for extensions on assignments, consideration for additional absences, assistive technology, physical accessibility, and there are many others. For example, mobility specialists, there's many others, but I'm just giving you the core of what most of our students are approved for. So these are academic accommodations. Next slide. Okay, again, I just want to reiterate that academic accommodation is not a fundamental alteration of program requirements or standards. Sometimes, and I'll give you an example, sometimes we get students that say, due to my underlying disability, it's difficult for me to do multiple choice questions. I'd rather have open-ended questions. That would be a fundamental alteration of the class requirements because they give out multiple choice questions. Also, can I maybe hand in less assignments? Or a different type of assignment, or maybe a change in class presentations. That again, that would be a fundamental alteration to the class. And we would always tell the student to talk to their professor to see what options are possible. So we also provide, all universities provide reasonable housing and accommodations. So I'll give you examples: wheelchair accessibility, possibly a single studio where it's just you share living space just with yourself, okay? Nobody else. Maybe a single en suite where you share, you have your own room to sleep in, but you share the other parts with other students. and it could be air conditioning, no carpet, proximity to campus, possibly move-in early date. So these are many, just some examples of what a reasonable housing accommodation is. Everything's confidential. So any information that's regarding a student's disability and documentation should not be shared with anyone outside the university. It's disability office. So it's, we get many students that come and say, is it on my transcript? The answer is no. It's completely confidential. So I just wanted to make sure that everybody knows that today.
Thank you
Great.
both so much for your presentations and for kind of level setting everyone for why we're here today. So now what we're going to do is really kind of have a discussion. So we encourage everyone who's on with us today to open up the Q&A tab. Go ahead and enter a question. I've got some questions of my own, but also going to be able to take the questions that you all have as well. So please open that Q&A chat and go ahead and enter yours. So the first question we're going to talk about today is, what should families do when they're in high school to start preparing for the transition to college if they have a chronic illness?
That is a great question. I think Tim gives the overview, and I of the college of what to look for, and then I give it the accommodations perspective. So I could start with the accommodations perspective for you all. So I think it's important to for all students to, whatever universities that they're looking into, is to look at what is the disability office like? How do I request academic accommodations, housing accommodations? What is the process? What does the layout of the dorms look like? How far are they from my possible classes that I'm taking? What does the campus look like? What are the transportation services on campus? Also, what groups that college is a great time for social connection. So what possible groups can I join to meet other students? That's important. Also, I think it's very important to know what all the resources are in a university. I always tell the students, this is a huge transition from high school to college. So look at there's so many services available that students really need to look at. Academic resource, tutoring, counseling and wellness is huge. It's such a huge transition for students, and there are counselors available to help with this transition. Also, the health center. What do I do if I get sick? Very important. Very, very important. Where is the health center? How do I make appointments? What insurance do I have to have? How do I get in touch with somebody about the insurance? How do I get in touch with somebody to make an appointment in the health center? Again, in the disability services, how do I request housing and academic accommodations? What are the steps involved? These are all important questions. What services meet with, how do I get in touch with my accessibility specialist? Can I make appointments weekly? Can I touch base with them weekly, bi-weekly? If I have a flare-up, can they be my point person? There's just so many, just keep an open mind with all the services and all the people that really want to help students to enjoy this wonderful experience for everybody.
Well, it sounds like what you're suggesting is make a list of questions.
Oh, absolutely.
Start thinking about what are all the questions you should be asking is a great way to start to prepare. Tim, what would you add?
Yeah, just a couple quick things to build off that. Bridget really talked a lot about the health center, which I appreciate. One of the things to know is that not all health centers are built the same. Just thinking about what are the services at that health center, and make sure you know that. And then if they don't have what you need, where is it locally from there? Is there a urgent care? Where's the hospital? Where are all those things? And if you think about, go to what you have now that maybe you take advantage of, and you might forget that are there magically for you in your hometown. Go through that list. What do we count on? We always go here because that always has the best this or best that. Try and find that, or something, a combination of that. You won't probably find it the exact same way, but you're looking to find that in an amalgamation, right? So you don't have your exact hometown doctor, but is there a doctor that can meet your needs in that town? So just think through that. Like, what are all the things we go to every day, every month, whatever it is for your support? Again, pharmacy, proximity, those types of things. How do you get them? Can you ship them? Like, for example, we have a pharmacy that has a really good formulary, but they don't all have a pharmacy. They don't always have the same medicines. The other thing I want to go away from just from the services, other than I will just mention quickly, dining. What's the dining plan? Can you get an accommodation to maybe not have a dining plan? What are their options? I know a lot of schools, and we have this too, they'll actually make meals specifically for a student, custom meals for the student. So they just email 20 minutes before they're coming or text, and they'll make a meal that works for them. So going away from services, start that process of preparing skills. I mentioned this briefly before. Student needs to know how to do some of these things on their own and figure out their own bandwidth to do it. So they're going to be the ones there. They're going to have to get comfortable independently communicating their needs in the school and medical settings, learning how to schedule doctor appointments. Who are those doctors? How do they do them? Refilling medications, getting used to taking over their care routines. Family's not going to be with them in the residence hall. So thinking about those and building those skills, practicing buying groceries, making meals that align with their dietary needs. That's not something you want them to start doing the day of move-in. So I almost think of it like practicing life in this way ahead of time is going to be really valuable for them to practice and learning some of those skills. And then again, what are the other services they need in town? And then last, I'll just mention medical records and documentation. Make sure you have that all together. 504s and IEPs aren't going to translate directly from where they are to schools. They're all going to be a little bit different. But having that all together, so you don't just say, I've got a 504, I'm done. What's the documentation behind that? Having that ready ahead of time and start working with those centers and the disability offices ahead of time, it's good.
Thank you.
I'm
Appreciate
so
that.
good. I'm so glad, Tim, that you brought up about dining. That's very, very important. Another thing, where are the dining services? Where are the buildings? Is do I need for my dorm to be closer to the dining halls? What are the meal plans? What are the meal plan options? Do I have to have a meal plan? Again, at NYU, all freshmen need to have a meal plan, but we review requests for a meal plan, either reduction or an exemption. We also can, also there are dietitians that students can reach out to talk about their meal plans and what best suits them. So I agree that this should all be in place before you step on campus, so you just know where everything is and how to be best prepared.
Well, it sounds like that's the name of the game. Ask questions,
Yes.
gather information, and try to really prepare to get your child ready for that transition. So we've got a question here from audience. Does the size of the college make a difference in how good the university can accommodate for your disability? Or do just accommodations differ from college to college?
I could speak from working at NYU for 16 years, which is a big university, decentralized, but we have our Moses Center, we have our testing center, we also have our testing center in Tandon School of Engineering, and it all goes through our office, which is great because if you ever have any questions, you could reach out to your accessibility specialist at any time. Also, accommodation requests change. You might request accommodations freshman year and say, you know what, I might need more, I might need less. You reach out to your accessibility specialist. So you are teamed with an accessibility specialist from the day you submit your applications. And that would be your point person in the university. Also, they could also work with you on how to approach your professors, how to say if there's an we say everything's confidential. So you just say, professors, these are you introduce yourself. I just sent my accommodation letters. There might be times where there's an exacerbation. Can we talk about like what is the process that works for both of us to request extensions, absences? So you could always work with your accessibility specialist on those points that work around accommodations.
So it sounds like what you're saying is make sure you're contacting the offices of disability at the colleges that you're interested to learn about what is specific to that place, but that every college or university should have something that they can do Tim, what would you like to add?
Yeah,
Absolutely.
I would say you should look at size, but you should not get stuck on size.
Right.
There could be the biggest school you've ever seen could have the best disability services and accommodation system you've ever heard of. A small school could not. So I think you look at it more about the size and all that is more about the student's comfort in the environment.
Mhm.
And then you should specifically, as you just said, Jennifer, you should look specifically at these services. But I wouldn't rule out a big school or rule in a small school without doing that other research. I think bigger and small is less important for this and more important about your students'
Mhm.
comfort, and they're looking for culture. Culture, community is going to be more important, and then look into what are the actual services they provide.
I agree. And I'm just echoing what Tim said about location, weather. Weather is very important. Is it in a city? Is it rural? What do you like? What are your interests? What do you like to do? Very, very, very important for students to really do that research.
You both have talked a little bit about health centers. We've got some questions coming in about those. For example, some people with eosinophilic conditions require weekly injections for their treatments. Do health centers support doing that, or would they need to find a local medical office?
I would say it depends. I don't know how Bridget, I mean,
Yeah.
everyone's different. Again, it's the kind of, some will and some won't. Some do allergy shots, they'll do these, any number of different sort of injections, and some won't. It really depends on what they have. If you had asked me 20 years ago, my school wouldn't do it. And now they do a lot of different injections, but it's going to be really hard to say yes or no across the board. It really is an individualized thing at each school that you'll need to ask that question.
I agree. Also, another point, there's admitted days in most universities where you can go and talk to the different offices to gather all the information in order for you to make your decision. So that's very important too, to go, once you're admitted, go to the schools,
Yeah.
meet with everybody.
And that's a great point, Jennifer. I can jump in on that from Bridget's point. One of the things I think is really important is that you fully embrace the opportunities that are there. We have preview days where you can go and you can do a tour, but also do a preview day that gives you a little bit more information. And then after you get admitted, they have then admitted student days. They're all called different things at different schools. We call them choices here. Go to those days too. The more points of contact you can make, the better you're going to feel, the better prepared you're going to be, the more time you spend in that community. The way I like to tell people is that these are the appetizers preparing you for the meal. If you like the appetizer, it tastes good, it's prepared well, it feels good, then the meal's going to feel better. So go to all those appetizer opportunities to get used to the place and ask those questions and say, do you feel good, not just on this campus, but in this community? Because you've got a few different additional questions you need to get answered. So spending a little more time there is going to be really valuable.
Sounds great. Sounds like you're advocating for lots of college visits. Wonderful. Alrighty. Well, while we're on the topic of medications, what tips do you all have for managing medications, medical appointments, and flare-ups?
That's a good question. I think, I think, again, know the resources, college campus, also know go through the course syllabus, reach out, create a plan with your accessibility specialist on what happens if I miss class, maybe adjustments to workloads, maybe there's incompletes, possible incompletes. What does that mean for a class? Possibly, again, reduce course load. What does that mean? Also, working with your professors so you have a plan in place in case you do have a flare up.
Yeah, we'd recommend a couple things. One, to practice ahead of time. Again, while the student's still home, maybe sophomore year, you start a little bit of this, then junior and senior, it sort of ramps up over time that they're starting to take some responsibility for this themselves. So there's a count maybe in their calendar system, like a Google Calendar, whatever they use, start having them do this both for class assignments and medication. So using apps like that with reminders. And again, maybe sophomore year, they're responsible for one medication and the timing of that. And you check in regularly. And junior year, they're taking a couple others. And you're building that so that by the time they get to college, it's not a new thing they're suddenly trying to take responsibility for. The thing to remember is that college is an overwhelming experience. You're moving away from home to a new place with all new people. It doesn't matter if 10 people from your undergrad or from high school are going there. It's all new, and your biggest support systems and structures aren't with you. So what you need to do is remove those number of overwhelming things by having them be part of their life earlier on. So managing some medications before they get there, some appointments, instead of you always telling them, hey, your appointment's coming up on Tuesday, saying, when is your next doctor's appointment? And start building that resilience and that knowledge and that skill ahead of time. Then also, once they're in college, to build a flexible schedule. Don't do a 9 o'clock and a 10:15 and an 11:30 class. Build in, okay, I'm going to have a 9 o'clock and then I'm going to give myself a break, because you don't know what this is like yet. Because meals are going to be important in this scenario, make sure the meals are on there too. When I have students coming to college, I always say for them, have a paper calendar from the beginning, and you put when you wake up, when you take your meds, when you have a meal, when you have class, when your assignments, everything's written. At least for the first semester, you should write every single thing down. Bedtime, everything. And they need to get used to doing that. And that's why I like them to prepare starting in early in high school, so they have that skill built and it's not overwhelming. But the flexibility allows them buffer time for rest or unexpected health needs, versus saying, oh my gosh, I'm having a bad day. I'm going to miss 3 classes today. Spread them out over the course of all 5 days. And sometimes students may want to look at one online class that's maybe asynchronous, that gives them a little bit more flexibility. So looking at the entire schedule to give themselves that and manage that flexibility for themselves in case there's a flare.
The one
Also,
thing
sorry.
go ahead.
And I'm again echoing what Tim says. I think it's important also to recognize what are the warning signs of a possible exacerbation or a health decline. It's very important. And again, rest, sleep, food, very, very important to have a plan for that in college. Also, in your dorm, know who your resident director is, know who your RA is. These are very, very important sources if something comes up or you need assistance in the dorm. Very, very important to know the names, contact person, and where they are in the dorm.
Thank you. So one thing you've both mentioned is about how important it is to create a plan. And so in many different medical conditions, including many eosinophilic conditions, people have a medical action plan or an emergency protocol for what happens if I have a flare-up, if I have challenges. Who from a university setting should be involved and aware of either creating that plan or be aware of what to do if that needs to be enacted?
Bridget, you want to go or you want me to go?
If there's in the dorm, if there's an emergency in the dorm, your RA, your resident director. In the classes, that would be most likely under the umbrella of the health center. I encourage students to meet with the liaison at the health center to discuss the protocol and what's needed and a game plan.
And we would say, again, every school is going to be a little bit different, but we would want you to work with, on our campus, a disability services office, our health center, as well as our dean of students. And that three organization or 3-person team, we would call it, is a really good starting point to plan it, like to come up with a plan on the front end. And then the student would want to take some responsibility for letting their RAs know about a condition, letting roommates know. We don't want roommates to suddenly feel like they're responsible for care, but they can be a caring human. I hope that makes sense as 2 different things. They want to know if something does happen, here's what I would need you to do. We don't want to put undue burden on just another, freshman student in the room. But that 3 sort of prong team is important. And then individually in the classroom, depending on how things might show up, you may or may not want to tell faculty more or less. It's really a choice for you. But every school is different. I know for us, the dean of students tends to be a nice overarching responsibility that can pull all those pieces together. And then specifically in this area, disability services is such a great partner on our campus that can guide all that work. But all those will be different. And then the other I would say is, depending on what your needs are, having a local provider off campus as well. So, and that could be a mental health provider, could also be a health provider, but having that sort of team ready to go to help you, I think is good to set that all up ahead of time and have those people in place.
Thank you.
And also keep your advisor, touch base with your advisor, how to contact them. That's very important to have your advisor in that conversation to help you, say, for example, withdrawing from a class or registering for classes. Keep your advisor in the loop also.
And Jennifer, I'll just mention, I mentioned this earlier, but I want to repeat it. Having someone closer, if your student's going farther away. So I'll be honest, I have now a lot of friends whose kids are going to JMU because I went here and, so I have friends who go here. They consider me their just in case person. So I'm also the vice president, but I'm also about 12 people's just in case. So when one of them actually had a medical situation, I was the first person they texted and I was able to get there within 5 minutes to be with their kid. So that is something to think about. I can't do that for everybody, but having someone closer to the campus will be really important, especially if they're a little farther away. And that not only for them, but that's a really great peace of mind for family.
That's wonderful that you're doing that for your friends. So something people are asking about is IEPs and 504s. So we know that's something that people have in the public school and private school setting for different things. But how are those different when you get into college? What kind of resources, documentation is required that they can think about to support the transition?
I would tell students the first step really is to submit an academic or housing accommodations application. The interactive process starts then. You will be assigned an accessibility specialist and you can work with them on the appropriate documentation because every school is different. Every accommodation request is different. So I think the first step is to start with the accessibility specialist.
And I would just say every state is different. There's different laws involved. A 504 does not always require disability, but an IEP does. So just know that they'll be treated differently. The back end documentation is going to be what's most important. Having it up to date. Definitely had students over the years that maybe it had been 10, 12, however long, many years since they'd updated things. That's a little bit harder because some things change, some don't. So having things that are up to date and, we need to know what the current impact is and what the current needs are. Because again, remembering we're trying to remove barriers here. Having an up-to-date sense of what those barriers are is going to be really important.
Right. We look for what are the current functional limitations? What are the barriers for the student to learn in the classroom and to live in the dorm? So that's very important that we look for that, the current functional limitations.
Let's talk a little bit about food. So a number of eosinophilic conditions involve some dietary restrictions. And so this is a common challenge and question, whether they're traveling, just eating outside of the home, or preparing to move away from home is, how am I going to be able to eat safely? Can you talk to us a little bit about accommodations that are available? And one person is curious, can people take meals to go from dining halls?
I could speak from my school, and I'm sure every schools are very similar. Yes, you can take meals from home. I know there's mobile apps, there's emails, there's different ways of requesting your food. So they make it much easier to get your food that you are requesting. In terms of accommodations, disability offices can review requests for meal plan modifications or exemptions, depending on documentation, student requests. The first thing that an office may do is say, you know what, why don't you talk to the dietitian about your needs and what's available and what's a great match for you, and then come to us and we'll review your requests if you feel that you need more than that. More that you need to be able to get food somewhere else, that's not going to be sufficient for you. So those are very, very important questions. You can even go online to all the universities and they have all the information there.
One of the things I'll say, in addition to what Bridget shared, is there's lots of flexibility in dining plans. There's also lots of different places to eat. So for example, we have two, what I would call traditional dining halls. But they also have an unlimited plan. So students can go in there as often as they want all day. So I talked to a student last year who had the unlimited plan. He's like, I just wanted a banana. So I went in and got a banana and walked out. Or I wanted a drink, or I wanted this. So look at the options of plans. And then in addition to those two, like more traditional sort of all you care to eat places, there's also, I think, 22 other venues like a Panera or a Panda Express or a bowl place, things like that, that those are all takeout. So I would just look at the options, but most universities now have a variety of different options on how they can get their food. So while you don't take, if you just go in and sort of punch into our traditional dining hall, you don't really take that food to go. I'll admit I have absolutely walked out with some cookies from time to time. Don't tell anybody. But just look at the whole plan. They're usually very, very flexible.
There's also, I know many universities have dining dollars, so you can add to that, which is, it's not in the cafeterias, but it's around the area that you could purchase food.
So there's many different ways people can be able to get accessibility for eating, but the biggest thing is, again, ask questions so that you can be able to work together to create a plan. One of you even said earlier something about being able to text or message or submit a request in advance so that they knew that you were coming to eat so they could prepare your modified meal. Could you talk? I think it was Tim that was talking about that. Could you talk a little bit more about, like, if you need to avoid certain types of foods, what you can do to prepare for that?
Yeah, I'm actually really amazed, and this is not a JMU commercial, but I'm really amazed that there are dining services here. So they have a couple different things I'll just share quickly. One, we have a basically a worry-free zone in one of our dining halls where you meet with a nutritionist ahead of time. They'll talk through your needs, and then after that meeting, you get swiped into this. You can swipe into the space, so it's added to your card. And you go in, and it's all the different room is set up based on different allergies, different needs, allergens, and everything. You can cook the food in there. It's all kept separately. And I've had a number of students who've gone in there. So name your allergy, they've managed it in there. The other thing that they've done, because our students deserve not just something from a freezer they can reheat, they deserve a fresh made, fresh cooked meal. We actually have at both of those dining halls the opportunity where students will again meet with the nutritionist, have that conversation. They'll identify all the things. One of the students I was talking to had, I think she said 6 different allergies around food. So the chef every time made her own meal, every single meal. And all she had to do, and she actually had the chef's cell phone number. So she would text him, and all he said is, as long as it's 20 minutes before you come, text me. And I was having dinner. I need dinner with all the students all the time. We walked in. She go, I was like, oh, where are you going to eat? And she said, oh, I go over here and get my meal. Walked over, shrink wrap meal, hot, made by the chef, fresh, probably 5 minutes prior that it finished. She walked in, was handed her meal, walked over to the table and ate it. So know that schools understand the significance of this. They usually have amazing systems set up to be able to help you have that. Well, a lot of times students say, I can't possibly eat on campus. I'm like, it's going to be easier to eat on campus than off campus. I promise you. Give it a chance and talk to the staff. They're going to accommodate, I would bet, 98% of the issues that might come their way.
Thank you. Tim, I've got a follow-up for you. People want to know, how do they know if their kids are actually eating?
I don't mean this as sarcastic, I promise. You need to talk to them and find out. It's not something that you're going to be able to look at their I've never heard of this, where you're going to be able to look at their history and see how many punches did they use, look at what they ate. It's not even necessarily, I don't even know that that's too much of a privacy thing. It's just not a thing that we do. I'm sure that there's probably some way your student could give you access to look at their punch usage. You could probably look at that if they gave you access. I don't recommend it. I think that this is a plan for them to learn how to do these things, but I am sure, I just thought of this now when I was answering this. I guess if I wanted, I could give my wife access to our Jack card, as we call it, our Jack card account, for her to log in and see where I'm spending my dining dollars that I have here on campus. So you probably could share with them. I don't recommend it, but again, if you're worried about it, I get that. But I would just have that conversation. What did you eat today? Is a good way to start that conversation. And hopefully you can have that open conversation with them, because it's such an important part of their life here and their management of this.
Thank you. Bridget, do you have anything to add about any utilization tracking that is available in other places?
I think having an open conversation with your child, like, hey, how's the food? How you doing? Do you feel satisfied? Are you able to do your work or your social engagements or, say, athletics? Are you okay with that? I think start with your child.
So I'd like to circle now back to kind of classrooms. So one of the things we've touched on today is talking to your professors, talking to the school administration. So what kind of tips do you have for students to advocate for themselves with those groups of individuals?
I would share first, be a really good student. What
Mhm.
I mean by that is, and I don't mean that sarcastic either, go to class. When you're in class, sit near the front, introduce yourself to the faculty member, be a really strong student as a baseline. One of the things I worry about sometimes is our students that might need support are not in class as much, and then the problem is when you do have a flare and have to miss class, you've already missed a few. Build up a good rapport with the faculty member. Talk to them at the very beginning of class, sit near the front, ask questions, go to office hours. Be one of the better students because one, that's why you're there. I tell our students that their full-time job is school. So treat this like your full-time job. I even go so far as saying spend 40 hours a week on school. That's why you're there. But be engaging with that faculty member, engaging with the content, because it's a nice way to get a little bit more sort of flexibility when you do need it. So by being a present student, being a really high quality student, when you need some other help or guidance or support because of a flare or something like that, there's a great way to engage with them in that way. And then working with ODS is, I think, should be a really easy process. These are amazing humans who are there to support you through this process. Meet with them up front, go by and check in. I think Bridget talks a lot about, as we've heard, talking to your accessibility specialist. Having that good rapport and relationship really matters. When you're building on a foundation of strong rapport, everything gets easier.
I agree. You want to have scaffolding. And I have to say, do you know how many students say they're coming mid-semester and they say, I need help in the class. And I go, do you go to your professor's office hours? And they go, my professor has office hours. So again, please, I say for all the students, see all the assistance that's there. We want you to be successful. Look at the office hours, look at the tutoring center, look at your schedule with the tutoring centers, the math center. There's so much help out there, the writing center. So know how to access these resources. Talk to your accessibility specialist, have a rapport with them, ask them for assistance in that. I've had students many times, I'm nervous to talk to my professor. I'm nervous to send this email, and we'll go over the email and we'll send it together. So use these resources. They're there and they're available for students.
The other thing I would add really quickly is also find a faculty mentor. Faculty
Yes.
really connects. I was just the other day, I advise a student organization, and the student president reached out and said, I don't know if this is okay, but can we transition to a new advisor? You're really great, but I've met this faculty member. She's amazing. She's been so supportive of my disability. It's just meant the world to me. She also shares the disability, so we've really connected in this way. Would it be okay if you stop being our advisor and go to her? She was so worried that I was going to be upset. And I'm like, that's an amazing relationship. Faculty members are these amazing human beings on your campus that love a subject, but have decided to dedicate their lives to teaching it in a college environment. That's an amazing thing for you to connect to. So spend some energy and try and connect with faculty. You never know, that person could become a mentor for the rest of your life. They could become a supporter for you. They're going to write recommendations. So just realize that these are amazing people that love their subject and love being with college students. So engage with them fully, and you might be surprised what happens.
Thank you. So let's now pivot. We've talked a lot about professors and health centers and dining areas. Let's talk a little bit about in dorm situations and living scenarios. Talk to us about what a resident advisor's role is on campus and how they can help people with chronic illnesses.
So I'll start, and then Bridget, I'll make way for you. So I actually just got to meet with our RAs yesterday, all 240 of them. And I'm watching this group, and I was an RA for a year myself when I was an undergraduate student. These are students who've decided to come back for their sophomore, junior, senior, whichever year, or some, we had half of them were returners, with the sole purpose of making your life better, easier, more welcoming. And so these are upper class students. They've already been through this for 1, 2, or 3 years. And their role is to connect with you and build community with you and help you be successful. They do a little bit of, I'll call it sort of soft, holding people accountable, but their main role is community and helping you feel connected and built into the place. And so they're there. So I would get to know them, just like I talked about with the faculty member, get to know them. They can be really great supports for you. They can also become mentors for you as well. But their job is to help you. So ask them to do that. And them, and then there's a hall director above that. So just the structure here, usually RAs, resident advisors, and then a hall director who is anywhere from either an undergraduate, graduate, or a full-time person, depending on the building. And their job is to oversee the whole. So oftentimes RAs will have anywhere from like 15 to 50 residents. So there might be a lot of you or might not be. But you'll find, similar to faculty members, very few people go and talk to them. So go talk to them when you don't need anything. Connect with them and before you have a crisis or a challenge, and share what you feel comfortable and see where that goes. And the other thing I remember is I had a really great RA, but I also really got close with an RA in another hall. They're not just defined or confined only to their folks. So meet people, get to know them, and know that they're there as a resource for you and a support.
Thank you. What role do you all see roommates and peers playing in helping students manage their chronic conditions?
That's a great question. Again, as Tim said, and we talked about this beforehand, the students, your roommate's role really isn't to help you manage your condition. They could be there as, emotional support, or, maybe you not feeling well that day and they need to pick up your medicine or food. But it's really important to have a plan in place for when you go to those dorms for your specific needs. And if you feel that you need housing accommodations, to reach out to the accessibility office to start that process. And look, also very important for housing, look at the deadlines for housing. That's very important too.
And a few things I'll just add, roommates can be allies in emergencies.
Yes.
I think Bridget's point is really valid. These are not medical professionals. RAs, college staff are not medical professionals. They're not really qualified, and you don't want to put them in those tough spots. But decide what disclosure, what's your comfort and trust with disclosure. And then think about setting boundaries and using analogies, spoon theory and things like that to explain what this really looks like and feels like for you, of what are some of those limitations and those challenges you might face, and what's your bandwidth feel like, and all that. So I think explaining that, I think an analogy can help a student, especially a fellow student. And then look for those peer support groups or student organizations that can offer community and understanding. One of the things that I know for all college students, there are times when they feel alone. And I feel like that can be exacerbated for a student with a disability, and they're not. There's other students there on the campus. Privacy wise, we're not going to say, hey, guess what? You were both experiencing this. But spending some time in the ODS, looking at the peer support groups are out there and connecting, you'll find you're not alone. There's other students, but you've got to put yourself out there a little bit, but within your comfort zone. But helping your RA, your roommate, those folks understand a little bit within your comfort is going to be important.
And I could speak for NYU. We have a disability student union, and that's a great resource for students. They come together, they talk, they brainstorm, they have activities, they have events, and they could assist you. Hold on one second.
Well, thank you all so much. This has been so great to be able to talk through so many different resources and suggestions for how people can prepare for going away to college with conditions. So, Tim, I'll start with you. If you have one final tip for parents and for the teenagers as they're preparing to go away to college, what else would you care to share?
Yeah, I'll reiterate the one of plan ahead. Get ready for this before you need it. As someone who earlier in my life ran a lot, the races where I just showed up at the half marathon, having not done a lot of training, were not good experiences, right? But the ones where I had done a 5K 1 week and then a 10K and all that, I prepared ahead of time so I could be successful in that. This is the same thing. You have to get used to owning your own life in this space. So even basic things like getting used to, waking up on your own and doing your homework and planning your meds and all that, and taking responsibility for your own health is going to be important. You can't manage that on top of all the other transitions. So if you think about, I'll just use the running thing again, Jennifer, like if I'm not ready for a half marathon, and let's just call the transition to college a half marathon, I'm not ready to do a full marathon. So don't add another 13.1 challenges on top of it. Get used to some things along the way know, these are the 3 or 4 meals that are really good. I know how to cook them, or I know the restaurant, there's a restaurant in town that makes that and it's really good for me. All those things you want to plan ahead of time so that when you go to college, all you're doing is the typical college transition things. And then the last thing I'll just say for it is give yourself grace. Families, give yourself grace. Students, give yourself grace. If it feels challenging, it's because it is. These are challenging transitions for you to figure out, and understand that you've done it so far. You've done it for 18 years well. You've managed life. You've managed extra things, and know that you can do this as well. And you're going to be great at this. Just give yourself some grace and know that if you've planned ahead and prepared for this, that you're ready for it.
Thank you. Bridget, what final tips and parting thoughts of wisdom would you like to share?
I completely agree, is to be prepared. Be prepared before you come, because it'll just make things much easier, because again, it's a whole new world for students, and it can be very scary. It's completely new. And just to have a plan for scaffolding to just make the transition smoother, and just to know that there's so many resources in the universities that want to help, and to take that with you.
Well, for all of you that have joined us live today, and for those of you that are watching the recording, thank you all for submitting your questions. Thank you for sticking with us as we had our conversation today. And it sounds like the name of the game is ask questions and be prepared. Take time to go visit the places that your children might want to attend. Take time to go meet all of the people that would be involved with your care. And with a plan, you can be able to make things happen. So thank you, Tim and Bridget, for sharing your insights today. We really appreciate the opportunity that you provided to everyone.
Thanks so much.
Absolutely. I also want to make sure to thank our education partners for their support of this webinar series, including AstraZeneca, Bristol Myers Squibb, GSK, Sanofi and Regeneron, and Takeda. Our next webinar is going to be about strategies for health journaling. So we hope you'll join us on September 25th. We're going to be hearing from Dr. Joshua Smith from the Ohio State University. So you can register for that at apfed.org/webinars. You can also continue learning more about eosinophil-associated diseases by subscribing and listening to our podcast, Real Talk Eosinophilic Diseases. In the latest episode, we talked with Dr. Anna Henderson about bone mineral density and pediatric eosinophil esophagitis. You can find the episode at apfed.org/podcast, as well as Apple Podcast, Spotify, Audible, and more. We also still have all of the on-demand content available from our annual conference, EOS Connection. So you can register for that still for free at apfed.org/conference to be a virtual participant. You can watch all of the sessions on demand through the end of the year. Finally, we encourage you to continue the discussion started today in our online community on the Inspire Network. It's a great place to connect with patients and caregivers for support. You can check it out at apfed.org/connections. So thank you again to everyone who's joined us, and thank you to Tim and Bridget for all of your insights. If you have any questions that didn't get answered today, please email mail@apfed.org.